Hello everybody and welcome to October's Connecting Knots live event. My name's Sarah Furley. I'm the Director of Partnerships and I'm going to host the next hour. So through the next hour we are going to go to John Bruin to talk about what's happening both within the trust and in the system and any key messages. We'll be hearing from Becky Sutton, who is new to our trust, and she's going to talk about who she is, what her role is, and the vision for community health services. We're then going to have a little halfway interval where we'll take any questions. So please, if you have got any questions, just pop them in the questions bar and we'll pick them up halfway through. If we can't cover them all, we will pick them up after the meeting and put them on Connect. Then after that questions section, we'll go to Robert and Angela to talk about Black History Month, and then Tina that's going to pick up the transgender service. So that's our agenda for the next hour. So I'm now, without further ado, going to hand over to John Bruin, Chief Executive, to give us an update.
Hi everybody, welcome to Connecting Knots. Thank you for taking the time to be with us today. Really looking forward to today's agenda. We've got some really exciting, interesting things to hear about, and I hope you equally find it a good session. I've got quite a lot to get through, and you'll have spotted there's quite a few things going on. There's a bit of a cute clue behind me as to one of the most important things, if you take away from today, is to take 10 to fill in the National Staff Survey. More of that in a second. The first thing that I'd like to say is to thank everybody for what they're doing. It's really important to acknowledge the challenges that everybody's having to face every day at the moment, 24/7 across the whole of the organisation. There are a lot of cliches around about unprecedented times and the new normal, but we are in a situation that few of us have encountered previously. And you'll also be more than aware of Nottingham itself and Nottinghamshire being in the national spotlight for some of the very high COVID rates we have currently, and having to adapt to the seemingly ever-changing rules of engagement and local lockdown measures. Equally, they've been in place, as we know, for quite some considerable time in Leicester. And so lots going on from that perspective, and we'll attempt to keep you as up to date as possible as things roll out over the coming days and weeks. First, though, more specifically today, to mention flu vaccination. More than ever this year, it's important that frontline staff get access to this. And you will need to book in for your vaccination, and details of all this are on Connect. And equally, if you have it elsewhere, either through GP practice or commercially, if you are paying for it, don't forget that you can reclaim this money from us. The good news about influenza is that the equivalent season in the southern hemisphere has seen some of the lowest rates in recent times, probably as a result of the measures that have been put in place to manage COVID. So social distancing, regular washing, and a much greater focus on infection prevention and control. So hopefully the dreaded combination of winter, flu and COVID won't impact us as badly as we may forecast. A note from our Director of Nursing, AHPs and Quality, Anne Maria, who's on leave this week, just to re-emphasise our practice around COVID and concerns about whether staff need tests. This is a really important piece, and I have it written down so I don't get myself confused, let alone you. You'll be aware that we've got several outbreaks over the last couple of weeks in both staff and patients across the organisation. And we're specifically saying the following. So the moment a member of staff feels poorly, we ask them to go home and get tested, and they're poorly with the common symptoms of COVID. Do not return to work until you've had the result. And we are aware that there is sometimes a bit of a wait for some results to come back. If you test positive, you need to isolate for 10 days. If they're negative, you can return to work when you're well. This is the tricky bit. If you're positive and have at any point in the previous 3 days at work breached PPE guidance or not socially isolated whilst not wearing PPE, then the staff you've been in contact with must go home and self-isolate for 14 days. There's been a number of questions around why we're not able to do routine staff testing, where other organisations locally have been involved in that. Those trusts that are doing that are involved in a national study called Siren. So we're not doing that routine regular testing. And of course, if you're not sure, check the internet, talk to your managers, speak to the lines that we have open, supporting staff in this area. And so that's the specific thing about COVID testing. To add, there's also lots in the media currently, aren't there, about specific COVID vaccinations. We're anticipating that one of these may be available around about Christmas time, excuse me. But there are a number that are about to come into mass use, but the majority of the high volume ones probably won't be until the spring. We'll keep you updated on that, because not only is it going to be important that we avail it, the vaccine to our staff, but we'll be a really important provider of that vaccine across the county more broadly. So watch this space on the vaccine. I wanted to flag Recognition Week a couple of weeks ago. We had some really positive feedback about that, and it was a really good celebration of the fantastic things that staff and teams are doing again across the whole organisation. The executive team particularly enjoyed having some direct conversations with people that have been nominated by their peers around some of the fantastic work they've done. So again, that's a watch this space, because we're repeating this towards the end of the calendar year to link into some of the celebratory approach that hopefully we'll be able to have, albeit distant, during Christmas time. So take 10 staff survey. I know I bang on about this a lot. It's critically important that we know what your experience is working for Notts Healthcare. It takes 10 minutes. We're supporting you to do this during work time. I filled mine in. It took me 10 minutes. It's a relatively fail-safe online form. It is completely anonymous. Yes, there are number identifiers, but these are for the external company picker we use, that use to authenticate who's responded, so they don't keep sending people reminder emails. We get collated information that goes down to divisional and team level. So we have a sense where we might need to focus staff being able to access and complete it. It's a really important part of our feedback. And of course, there is free text as well, which we use every year to collate thematics. For example, our next contributor, Tracy, our staff and health and wellbeing lead, the development of that service was really driven by it being a probably one of the commonest pieces of feedback we got from the staff survey over the last couple of years. So, okay, and we'll be reporting over the weeks our response rate. We're currently just under 20%. That roughly puts us as a sort of an average responder compared to some of the national stats we're going. So let's try and get above average. There's obviously an internal competition as to who can be the best directorate. I won't say anything more specifically than that, other than at the moment, the forensic division is in the bronze medal position. Get filling it in. AHP Day, 14th of October, fantastic session. I just wanted to make a point of recognising that nearly 10% of our staff are AHPs. The great work that they do, the way that they've had to adapt their services during the pandemic has been quite remarkable. There are some great examples available on Connect and elsewhere, and we heard some really passionate and heartwarming stories on the day. It's full of lots of love in their boat, and I get a sense that feeling more connected to the organisation, they can often be an area of provision that gets a bit overlooked. But I was really pleased to sit on some of those conversations, and again, I think that's something that we'll be continuing to look at, how we can grow this and repeat and celebrate some of the great work that we're doing. Finally, from me, before I hand over to Tracy, to say just a little bit about living our values. We've, as you know, done a really great piece of work on refreshing those over the last year, and the sense that honesty, trust, compassion, respect and teamwork are now sort of our guiding principles of how we work together. Embedding that across the organisation remains a really important part of what we need to do. Both as a board and as an executive team, we've taken some time out to look at the values in more detail and look at a template called behaviours in practice, because we know that they can mean slightly different things to different people, and they can have also different implications depending on the teams that you work in. So get involved in that work and send us your outputs, because I think it's really important that we can share that across the organisation, and it develops a sense of community and working together as one trust. So that's me done as a quick roundup. Lots going on, but to emphasise my thanks to you for all that you're doing at the moment, and let's keep on it, keep passionate about our shared ambition to do the best we can for all our service users, our patients, families and carers that we look after. And thanks very much, everybody. I'm now going to hand you seamlessly over to Tracy Orlandi, who, as I mentioned earlier, is in charge of our staff health and wellbeing service. Tracy, over to you.
Thanks, John. Well, I've got 8 minutes and I'm just going to put my stopwatch on to keep me on track to cover an amazing amount of work that's been undertaken by individuals, teams and departments in the trust, as well as my team. And I think the 3 things that I wanted to try and share with you today are the Health and Wellbeing Champion Role. Yesterday was World Menopause Awareness Day, so I wanted to touch on that, and the ongoing support for COVID, which John has just mentioned. You know, who would have thought 6 months ago that we'd be gearing for, you know, a second wave and be where we are today? And we recognise people are tired and anxious for the future. So I just wanted to share that ongoing support that's available and how that's evolved as we've gone through this pandemic. So let's start with something that's not specifically COVID related, which is the Health and Wellbeing Champions. So if I could have the next slide, please. So when I joined the Trust, I was absolutely amazed at how many people we have as champions, whether that's mental health first aiders or recovery champions or health and wellbeing champion. What we've tried to do over the last few months in particular is take that role overall and say that you're all supporting agendas that are important to the Trust, and how can we harness that energy and enthusiasm and, you know, support that overarching communication strategy, knowing that actually the people that we listen to most in most circumstances are our colleagues and our team members. And this is really a plea to say that if you're listening today and you think that this is a role that you could fill, you know, you're enthusiastic, connected, enjoy talking about health and well-being and like to support people, then we still have capacity for people to join this role. And what we hope that will do is that you will tell us what you'd like the health and wellbeing framework and support services to look like, in addition to the staff survey, which I know that you're all completing, in particular the wellbeing components. So what are your interests, what are your needs, what are your likes, and how can we make sure that we're delivering that in an accessible way across, you know, the Trust that's so geographically challenged. And in return for that, we have a number of opportunities for people to gain formal qualifications as part of their professional development, whether that be stop smoking, formal qualification, walk leader, menopause peer support leader, which I'll talk about more in a moment. And there will be an application process for people to apply for those roles if they have a specific interest. So if you're interested in that role and you think that you would like to find out more, all you need to do is email the staff support service and we can invite you into a quarterly meeting where we'll provide you with updates and formalise that role for you. I'll wait for the comments box to come alive with people saying me, me, me. So if I can go on to the next slide, please, which is menopause awareness. So this is a topic that I'm really passionate about, and I know that when I speak to people about it, it's a real topic of interest regardless of gender. I've had quite a few male managers say that they'd like to learn more about this topic, and people who feel that they would like to know more because of their personal circumstances at home. So I'm really pleased to share with you today what we're doing as a Trust to raise awareness to become more menopause aware. So just a few quick stats. Average age for menopause between 45 and 51, 51 being the actual age where many women recognise that they've going through the menopause. And 1 in 4 of those will have significant debilitating symptoms that impact on their ability to function in work or outside of work. So that's a startling statistic there. Research shows that people often don't talk to their manager about it, but when they do, employees can make a massive difference. So we really want to reduce the stigma and get people talking about the menopause in the workplace. If I can go on to the next slide. So in context for our data, 26.8% of our workforce are female and aged between 46 and 51. And that means that nearly 2,000 will have symptoms and 586 will be that 1 in 4. So that's over 500 people in work today who are experiencing significant symptoms that impact on them daily. And then the last stat, just to bear in mind, is 1 in 100 women will go through the menopause a lot earlier than that statistic. So it's not necessarily an age-related topic, and therefore we need to be mindful of that in our conversations and sensitive with people around that. Next slide, please. So this is in 3 parts really, and we're going to be running a few managers and employee briefing sessions to share this, but if I could just click again for the top symptoms affecting work. So you'll see along the bottom that there was a multi-agency research piece around what symptoms affect work. So if I could just have those on. And you'll notice a theme in here that actually the physical symptoms are there, but most of the symptoms are around cognitive functioning, tiredness, fatigue, those sort of things. And I think we can all recognise at this current time how that would be impacting on work. If I could have another click, please. The top characteristics that make the symptoms of menopause worse at work are listed below, and I'm keeping my beautiful assistant busy with their clicking finger today. And I won't go through each of these in turn, but if you think about some of the physical implications of the menopause and wearing PPE, and we're thankfully through summer now, she says, and into autumn, but still a massive issue around body temperature and feeling that you're in a confined space within an open space. But there are some good news in there around having regular fluid breaks and some self-help in there. And then the last section of this, which will come in on the bottom left of the screen, if I could just ask my beautiful assistant to tap twice for me. So, I've gone one too over, sorry, Jen. So there are symptoms that people may feel uncomfortable talking about along the menopause in work, but can affect people at home and work. And I won't list those in turn, but suffice to say that support is available for everything that is contained on this slide. So we'll go on to the next slide if I can. So you might be thinking, well, what support is available, Tracy? Tell us what's available. We'll be running some menopause workshops, which will be on Connect, the dates for employees and managers, and we'll be using the Chartered Institute of Professional Development campaign called Let's Talk Menopause, and you can see an example of the infographic there on the right. We're also going to be highlighting the many menopause peer support groups that are already established within the Trust. So, for example, there's one set up at Highbury, and the people who lead these groups are quite happy for people to join them from other locations via the wonderful Teams function that we have in the Trust now. But I'd also encourage people who feel that they would like to support a group to get in contact with me, and we can establish many more of these as a support network for staff. Bi-monthly, starting in November, we're going to have some specialty-led seminars, starting with HRT, and really dispel the myths that come along with the menopause. And that will be supported by information on Connect. And we're asking departments to become menopause friendly. And if you're a department who'd like to support this campaign, just drop us a line at the staff support inbox, and we will send you out a pack which would include all the marketing materials, posters and leaflets. So I'm not going to talk about menopause anymore, but if you're still interested, Claire Teeney, our Executive Director of People and Culture, has done a really short podcast that sits on Connect that gives a bit more information, so I urge you to view that. And then last but not least, in my last 30 seconds of my timer, I just want to reinforce the next slide around the ongoing support for coronavirus. So we're hearing lots of people tell us that they're struggling with working from home, physically and emotionally, feeling isolated. Was hoping that some of that was coming to an end, but clearly we've got a little bit more of that in the future coming upon us. So the staff support team are here for you and for managers. So if you've got an individual, a team or a whole department needs support, get in touch. Our role is to help you navigate easily around the raft of information that's around there. Our team are also merged now with the COVID-19 team who do the antibody testing, the swabbing, and we're about to enter into phase 4 of risk assessment. So keep an eye open for that. And if you haven't had a risk assessment yet and you feel that you should have because you have a long-term health condition or a protected characteristic, make sure you speak to us or your manager. And then for many, I think COVID has made us think a little bit perhaps about our lifestyle choices, knowing things like obesity and smoking can impact on poorer health outcomes with COVID. So we've got some other health promotional activities that people can join as well. So with that in mind, I'm now going to hand over to Becky, and Becky and I have worked together in a couple of organisations in the past in Derbyshire, so I'm delighted that she's joined us here, and I'm looking forward to hearing a little bit more about her role. Becky.
Thank you, Tracy. Thank you. So I've got 10 minutes to sort of introduce myself, and thank you for that intro. Yeah, me and Tracy seem to follow each other around in a couple of organisations. So I'm just going to spend the next 10 minutes telling you a little bit about me. You'll soon pick up that actually I quite like pictures and not lots of words, hence some of my slides, and I've only got a few to share with you. So the first thing I want to say is thank you. Thank you for the incredible welcome I've had to the organisation. I've been here just over 2 weeks, and I think I can say everyone I've met has been thoroughly welcoming, helpful, and encouraging about the role that I'm picking up from here. So I thought what was quite helpful is to tell you a little bit about me, where I come from, who I am, put a bit of a story to a name, and then just a little bit very briefly about my role, and a little bit at the end about where I see in community services going, albeit I'm not really sure yet. So 2 pictures on there. What about me? So the first one was taken not long after I started work. So I'm actually an audiologist by background. Started work before I'd even left school, actually, I'd got my job. I was going to go and be a nurse, but this post came up and I thought, oh, that sounds quite good. No shifts, no working, and was quite interested in ears, so got myself into that. And really, I think it's true to say I'm a proper started my way at the bottom. It was an apprenticeship type of role that I started when I took up my career in Peterborough, which is where I come from. Slightly strange accent, but you'll get used to me. And Absolutely adored my job as an audiologist, trained up, worked my way through the ranks really, and did that clinically for about 10 years. And always think to the day, well, if I'm rubbish at this leadership management malarkey, I can always go back and be an audiologist, albeit might need to do a bit more training now really. And from then gone on really to do all sorts of jobs within the East Midlands. So moved up here 4 years after I qualified, so I was in Peterborough for 4 years, then did 10 years over in Leicester as an audiologist, and then got quite involved in improvement and was always not really satisfied with the norm. So how can we do things differently? How can we improve this for our patients? So at that stage got really interested in improvement and the improvement journey, and have done a number of roles nationally and locally around improvement. So went on to work for a national team, spent a tiny bit of time in Nottingham, so do know a few faces and names still around in a sort of cross-organisational improvement team, bit like system working, but they weren't really ready for it them days. And then went on to work in Derby Hospital for 10 years, again, combination of improvement roles, but really then went to do quite a number of operational roles, service manager type of roles in medicine, including medical assessment unit, ED. I've managed that a couple of times, come here for a bit of a rest, but that's a different story. So worked in Derby for 10 years, and then latterly I've just come from Chesterfield Acute Trust as their divisional general manager, again all things medicine and emergency care. So the bit about me on the other side is, although I'm here as the Director of Community Health Services and really proud to have got where I am today, the other picture is the other part of my life, which is my two lads, my husband and my dog, overtaken by men in my house. So just a little bit about my values when I came to the organisation, aligned very nicely with some of the things that you're working on here. So I think honesty is a key for me. You'll get used to me in terms of, I say it how it is. I like to be open and honest with people, and that openness in terms of the other picture with the arms wide out. You know, actually we're all here to do a job, and it doesn't matter who that is. I'm interested to hear your views. The other mug, which you can just see on my slide, was a leaving present that I got from Chesterfield, which I thought was lovely, really. And one of the things I'm also really keen on is about empowerment, but also growing our people. So I think my job, absolutely, as a leader, is about encouraging staff, which is the only way I've got where I am today, is through managers and people encouraging me to take that next step, to not be satisfied with the norm and to challenge. So I'm keen to hear from people and build those people as we go along as well. Next slide, please. So what is my role? And again, I think you've seen a number of new people come into the organisation, so we've probably come with similar slide sets. But I think there's two parts to my role. So one of my role as the Director of Community Health Service Division is around all things community health services. So whether that's thinking about how we plan services, the delivery and the development of them and the performance of them as well. So my view around keeping that leadership role around how we develop, how we ensure that the services we deliver to patients are absolutely the best they can be, and to take everything, all things community health forward as a division. Next slide, please. So the next role, which I'm really excited about, and a new role for me, is around that board role. So being that board member of this organisation. And one of the reasons why I was really excited when the role came up was it is a bit of a different organisation to what I've worked in before, but absolutely fascinating from the outside looking in. So really keen to get involved in that more corporate role around all the services we provide as an organisation. So community health, mental health and forensic services, and there's a real diverse portfolio of those services, so I'm really keen to find out a bit more about that. But really importantly, as a board member, my role around that leadership role is about helping the board set direction, is about overseeing performance, whether that's within my own division, but giving that constructive challenge across the other divisions as well. But more importantly, is really about setting the culture for the organisation. And I think it's really important in terms of leaders that actually we're here to walk the walk and talk the talk and actually set the culture for how we want things to be. And so far so good in terms of what I've seen. Last slide, please. So the other bit, interesting picture. I was looking for a picture around integrated health services, and there was all sorts around them, lots of words. But essentially, my vision for community health, and I think certainly in the couple of weeks I've been here, it's a really exciting time for community services. Actually, we've got a real opportunity in Nottingham and Nottinghamshire to do things a little bit differently, or actually enhance some of the stuff that we already do. So there's a huge amount of work that goes on in community services, and some of that's very specialised, and some of that is a bit more, a bit different in terms of how it works across our patch. So I think it's a bit early to say what I think that vision is going to look like, but what I do think we need to remember, particularly around system working and integrated care, is about putting the person or the patient at the middle of whatever those services look like. So I'm really passionate about population-based health, around ensuring that actually we wrap our care around the patient dependent on the needs that they have. Appreciate that the needs of those patients are very different depending on the different localities that we've got across Nottingham and Nottinghamshire, which is huge and vast. And then how we work with our partner organisations to ensure that care is effective and efficient, and actually they haven't got different people coming into their house to do different things to them. I think we've also got a real opportunity, and something that excites me about how we bring together some of the physical health and mental health as well, and actually manage that person or those people as a person, and actually not think about those in two separate ways. So I think the future for community services is bright. I think there's loads of opportunities. I'm really excited to be part of that journey, as well as being really excited about being here. And as it probably hopefully comes across, you know, my enthusiasm and energy is boundless. I'd like to say I calm down, but sadly Tracy knows me too well and I don't. So I'm just really, really honoured to be here, to be able to take this story and these services forward. Thank you. I'm going to hand back to Sarah.
Lovely, thank you, Becky. Thank you. So we've now just got about 10 minutes on some questions, and we've had a couple of questions that came in before we started the event, and a question that's come in during the event. So the first question I'm going to take actually came in before the event, and I'm just going to read it to you. I'm going to answer it, and I'm then going to hand over to John as well for his views. So the question is, with COVID and the trust downsizing by closing some locations, this is pushing more staff into working from home. Do you think this move might contribute to antagonism in the trust, with bases spread and people seeing less of each other? Are we in danger of losing those personal relationships that enable us to work better? If you do feel like that, how do we overcome those issues? So that's the question. I think that everyone's COVID experience has been different, and I don't think one size is going to fit all. I've experienced meetings actually where working from home, relying on MS Teams, has actually meant that we've got a greater attendance at meetings, not less attendance, and I think that helps build relationships, helps build teams, and perhaps this live event is one such example. However, one size doesn't fit all, and MS Teams doesn't work for everything, and I certainly think that we've got to work at our relationships. And I think for some people working remotely, whether that has been caused by COVID or whether they were working remotely before, people can feel isolated, staff can feel isolated, and certainly Tracy has talked about support for both staff and teams. And for me, there's nothing like perhaps walking up a corridor or bumping into somebody in a kitchen where you can have a very, you know, you might talk business, you might just pass the time of day about what's going on in your life, and I do think we need to work at that, even if that is picking up a phone or dialing in MS Teams and just checking in with each other. So so to answer that question, I don't think it is going to force us to lose personal relationships, but I do think we're going to have to work hard at maintaining them. John, if I come to you, is there anything else you'd like to add to that question?
Thanks, Sarah. Probably not really. I think you covered it as much as I would answer. I think it's a really good question. And yes, in the current climate, we are looking towards, aren't we, through the forecasts of possibly there being further restrictions and constraints across the county. And this is going to be with us for some time. And I think there will be a continued emphasis on, where possible, working from home. And as you say, yes, it does, I think, put a real challenge into spur us on to making sure that we can continue to maintain those personal and professional relationships. And we have to find different ways to do it, and to identify and support people that might find that particularly a struggle. We're all different. People who know me know I'm not a big fan of working from home personally. I'm not really good at it. I get distracted. If I'm in my office, I can do what's in front of me, and I don't wander off too much and chat to people. Well, I do like chatting to people, and passing the time of day and being interested in people's lives is a really important part of working, isn't it? And being together and working with each other. So I think, in summary, yes, it's a risk we have to watch out for, and it should spur us on to make sure that we do look after all our people as best we can. Thanks.
Thanks, John. And while we've just been answering that question, there's actually another linked question that has come in anonymously. So I'm just going to read that one out as well. Where we do not have enough space to enable everyone to work from the office, it will be helpful to be able to document their base as home for the purpose of e-expenses. The current need to have a Notts healthcare base disadvantages some staff. So that's the question. I think we've actually had this question before, so it's really clearly very on top of people's agenda. So working from home, there are consequences of identifying staff using their home as a base, and there are some issues about tax, as well as some benefits of expenses and things. We've previously put information on connecting knots, and there is also a working group that is just been set up that is starting to look at the consequences of working from home, whether that is having the right equipment, whether that's the consequences of expenses and taxes, and as that group starts to report, we'll make sure that we talk more about that. I'm just going to go back to John as well, who is just going to add something further.
Yeah, thanks, Sarah. And just to say, we are committed that by dint of now working predominantly from home, you are potentially disadvantaged on your travel expenses because you're not going into base. We are changing those arrangements for individuals affected, so that temporarily you will not be out of pocket. Well, you won't be out of pocket permanently, but these temporary arrangements will mean that you'll be able to be recompensed appropriately. Thanks.
Okay, thank you, John. And then there's just one more question that I'm looking for here from Anna that's come in during this event. And that question is about staff surveys. So the question is, we've been encouraging and pushing around the staff survey, but unfortunately some staff have not received one, and we've become aware of an issue about staff receiving them at all, which is difficult when we're encouraging so robustly. Have we a timeline when the issue will be rectified? Thanks. So just to answer that question, this morning, reminders for all have actually been about the survey have been emailed out. If you haven't received an email, it will have come titled Staff Survey 2020. If you've not received that email, please can you email the staff engagement team, and they'll look into the reason why, and there may actually be different reasons for why staff haven't received the survey. One of them is that the survey is actually only sent out to staff that are employed at the point of September, so that could be a reason. As well as other reasons. So please look out for that email and then contact the staff engagement team again if you haven't received anything. And also linked to that staff survey question, there was a question about have we completed that staff survey. I'm going to sit here and say yes, I have completed that staff survey, and the question was also linked to what's the benefits of completing that. So and I think John talked that through in his update. So that feedback is really important to us as teams, us as divisions, and us as a trust, and it is used at every level of our organisation to identify what's really important, what's working well, and what needs correcting. And then just looking. There's a question here from Jeffrey, which I think is going to be our last question. Just want to check, do non-patient facing staff need to get their flu jab from outside the trust, or is it just that those staff can get a jab from the trust a bit later on in the season? Becky, if I come to you, would you be happy to answer that question?
Yeah, that's fine. So I think if I get this right, and I'm sure somebody will tell me if not, that actually there will be an opportunity for non-patient facing staff to get their flu jab a little bit later. We're just focusing on the patient facing to begin with. However, I think my understanding is if people would like to go and get their jab from a chemist or a different provider, then there's a way of redeeming that cost back as well. So really, yes, we will come to you. It may take a little bit longer because of the amount of vaccines that we're getting through. And if you didn't want to wait that little bit longer, you can get it yourself and claim that back, if that's right. Thank you.
Lovely, thank you, Becky. Thank you. So I'm going to move us back into the agenda. So I'm going to hand over to Robert, who's going to talk through Black History Month. Thank you.
Thank you, Sarah. Yes, as Sarah said, my name is Robert Mook and I'm the head of quality surveillance, but I'm also the co-chair for the Race, Religion and Belief Steering Group. So I am delighted to be able to kind of introduce the Black History Month for our trust this year. And we're going to do this in two parts. So I'm myself going to provide some facts around what Black History Month is all about, and then my colleague Angela will give us an oversight of what to expect for this year's celebration. So even now I'm being asked, you know, why are we celebrating Black History Month? You know, why not Mancunian history or Yorkshire history? And although I can't provide an answer for those questions, what I can do is give an overview of why we celebrate Black history. So when did it first start? Well, believe it or not, celebrating Black history started nearly a century ago in the US, starting in 1926. It became officially known as Black History Month in 1970, following the work that was carried out by Dr. Martin Luther King. In UK, however, it started back in October 1987, so that was nearly 33 years ago, by a Ghanaian analyst named Akiaba Adisebo, and he was working for the Greater London Council at the time, and he did some work across America and he brought this over to the UK. So why do we celebrate it? Well, Black History Month it's an annual celebration. It's there to celebrate the contribution made by the generations of African and Caribbean coming over to the UK. And I think it's fair to say they helped shape the British nation as it is today and some of the cultural life. So for me, it's about three things. It's there to educate, it's there to challenge racism, and it's there to celebrate. So growing up as a young black person in the 70s and early 80s, I was taught some great history around William the Conqueror, Henry VIII, and Charles Dickens. However, some of the impact that black people had on our society wasn't there. So there was nothing about the pioneering work that was done by Mary Seacole. There was nothing about great black inventors such as Garrett Morgan, who invented the traffic light system, which is used across the world today, saving people's lives and keeping our roads safe. So challenging racism. Well, I think, you know, the recent events with the Black Lives Matter makes it quite clear that we need to educate people for them to understand what racism is. Racism, it damages life. You know, we talk about Black Lives Matter, but the impact that racism have on Black lives is really fundamental. And it's really critical that we get education in place to make sure people understand what racism looks like. And it's there to celebrate. So yes, there's been barriers and challenges on the way, but I think there's room for celebration. I think the contribution that black people's had on the NHS, I think 6.1% of the overall workforce in the UK are made up by people from African, Caribbeans and other countries. So celebration is there for us to acknowledge that the black people's history, the culture and its heritage. It's there to disseminate information about positive contribution that black people's had on our society, and it's there to make awareness of black people and their cultural heritage. So I have got a lot of information around that which I can share on the chat later on, but I'm just going to hand over to Angela, who's going to give you an overview of what to expect this year. Thank you, Angela.
Thanks. So this year, obviously, we're in unprecedented times. So what we are planning to do this year is we had a conference that was our annual conference was due to be face-to-face like we do every year. But because of COVID, we're actually joining with our ICS partners to actually follow on from the success of the virtual Pride event to do an ICS Black History Month event on the 29th of October, which will be on Microsoft Teams. Posters have just gone out recently between 12 and 2. So that includes Nottingham University Hospitals, Notts Healthcare, Nottingham City Council, City Care, Sherwood Forest Hospitals, Nottingham and Nottinghamshire CCG, Nottinghamshire County Council, and Notts Fire Service, who are not technically part of the ICS, but we have got a guest speaker. And what we as a system are wanting to do is to come together to recognise the outstanding contributions that people of colour have made to society and the organisations that we work in, and the historical and ongoing contribution to health and social care is particularly evident. What we wanted to do is, on the back of Black Lives Matters and the COVID impact of COVID on the BME community, was we felt that we still needed to mark Black History Month regardless, and it's even more important. So we wanted to foster an understanding and celebration of Black, Asian and minority ethnic history in general. So as a network of partners, we felt it was important to involve everyone of all ethnicities, races, nationalities and colours in the event. And also there's also an element of, we've had tragic events, but we've got an opportunity for better understanding and optimism that we can all work together to develop anti-racist and inclusive cultures in our respective organisations, and this will be through shared dialogue, education and committed leadership. We're wanting all ethnicities and protected characteristics to come together to foster good relations and move this important work forward. And so what our programme is a diverse mix of the acknowledgement of BME culture, but we wanted to celebrate. We've got music, poetry, spoken words, song and dance, because that plays a part in most cultures. So we wanted an element of celebration alongside. We do acknowledge that, you know, we've had some difficult sort of times, but we felt it was important to celebrate like we do every year. So the event will be, it's been advertised, and there'll be a website, and that will be on the poster, which is on Connect, and there'll be a Twitter hashtag NotsICSBHM, but that'll be on the poster. So now I'm going to hand over seamlessly to Tina Knock.
Thank you, Angela. That does sound really interesting, and I look forward to seeing that myself. So my name is Tina Knock. I'm the service manager for the transgender service, and we were asked to give a presentation on our good news story, which was strangely running a clinic during a pandemic. But what it made me think about is, do people know what it is to be transgender? So I have got rather a lot of slides, which somebody's kindly going to flick through at speed for me, so we can get to running a clinic in a pandemic. So my first slide is what is transgender? What are we actually talking about? And there are a number of words that are used by the transgender community or others to refer to transgender, and that can be seen in the next slide here. So the next slide, please. Thank you. Oh, sorry, it's going to be one of those that takes ages to load. So, as you can see, there are lots of words that relate to transgender, but the most important thing to know is that being transgender is where you do not feel at one with your identified or birth gender. So if we move on to the next slide, please. Our core identity is identified when we're children. Generally by the age of 2 or 3, we start to identify whether we are boy or girl. Our gender awareness by others starts to come together when we're about 7 and 8. And gender role is the social role imposed on us by our environment based on our biological sex. So as we know, boys are considered macho, playing with balls, bats, trucks and toys and like the colour blue. Girls are supposed to be caring, like the colour pink, have dresses and dolls, but that isn't always the case for everybody, and isn't always the case for those of us that are not transgender. So next slide, please. So sex. Sex is the term that actually defines whether we are born male or female, and we identify between those by our chromosomes. Women have XX chromosomes, men have XY, and generally they are characterised by the typical genitals and reproductive organs that we all associate with sex. Next slide, please. So gender identity is where we are in a body, perhaps with genitals and a stereotype that we do not feel we identify with. This is what we refer to gender identity and gender incongruence. Generally, we believe that there, or should I say, sorry, generally it's said that there is male, female and other, but life is more complex than that. Next slide. Next slide, please. Thank you. So a person whose gender identity does not correspond with their sex assigned at birth and based on those sexual characteristics are referred to as transgender. When gender identity does not correspond, it's called transgender, but when it does correspond, so when you identify with the birth sex, the biological sex you were born with, that's called cisgender. Next slide, please. There are a number of terms that are used within the world that we work in the clinic. Transgender male is where somebody has been assigned female at birth but identifies as male. Trans female is where somebody was assigned male at birth but identifies as female. But also we have non-binary, and this is where people who do not identify themselves as a man or a woman. Gender fluid is fluidity of the gender from male to female or female to male to others. And trans is the most inclusive umbrella term we have that refers to people with non-conforming gender identities. And as you will see at the bottom, there is the male, the female, and non-binary. And a person who's non-binary can be anywhere between that scale. Next slide, please. So that's a little quick, very quick run through of transgender. But we were asked to speak about running a clinic during the pandemic. So to give you a bit of background, our clinical lead started in January. I started with the trust in February, and then COVID occurred in March. So that had quite an impact on our clinic. Our patients are nationally from all over the country, so literally from Land's End to John O'Groats. And we have a national waiting list that is a problem across the whole country, which is over 3 years. And our clinic has paper-based records and systems. Next slide, please. So the numbers slide, there's always a numbers slide. So our clinic is one of 7 in England that are focused on transgender healthcare. We have an active caseload of over 1,500 patients that are seen between 3 and 4 times a year as part of their pathway. We have over 2,500 patients waiting to be seen, and our clinic waiting time from referral to first appointment is approximately 37 months, which is an extraordinarily long time, but I have to say, better than other clinics in the country. And we are working really hard on a number of projects to reduce that waiting time. Our clinic worked 5 days a week and was face-to-face prior to COVID. And referrals were increasing every month, year on year. Next slide, please. So COVID began in late February, early March, and we developed a plan, an outline plan. We could see what was beginning to happen across the country, and being a national service, we knew that that would affect us. So from the 16th of March, we ceased doing face-to-face contact and moved to telephone, and then in early April, moved to video consultation. Next slide, please. So the positive slide. Video consultation was adopted by all of our clinicians, even those who are very tech shy. We have some clinicians who they feel it's quite an achievement if they can get onto Teams, but they welcomed video consultation. Our team approach was to ensure patients were not adversely affected by COVID and what was happening nationally. We also had a commitment to keeping the clinic up and running and open for business when some of the other clinics nationally did close to patients. And we have had really positive feedback from the patients about how important it was for them to still be seen by a clinician. They are a very socially isolated group, and it was really important that clinicians were still working with patients at that time. The majority of our patients loved using video consultation, and it did have advantages for them. Next slide, please. So, strangely, it reduced our DNA rate because we were ringing patients at short notice to confirm that we were still going to see them and how we wanted to see them. Activity remained at the same high level as the previous year, despite the loss of one clinician through redeployment. And everybody, both on the clinical and non-clinical side, pulled together. A nice positive outcome was also that the the communication between us and commissioners in London improved. But with every positive, there is always a negative. And we do have a slide about that. So our challenges were, we didn't have sufficient laptops, which caused a wee delay. We actually had challenge from other clinics across the country about the ability to use video consultation and its appropriateness. And it did take quite a while for us to get into a system of managing remote clinics when we weren't electronically based. We'll skip on to the next slide. So the outcome, because of the work that we did in our clinic, we were asked to provide input into the change in the service specification that allowed video consultation facilitation. We were also asked to speak at a national programme board about our experience and feedback from our patients. The programme board were very keen to hear what our patients thought. And our clinic has become very much seen as a can-do clinic, who jumps at innovation, who prioritises patient care and access to treatment, which we all felt was really important. It was very much about putting our patient first. I have plenty of slides and far too many, but the most important thing was the feedback that we got from our patients. We undertook an evaluation project that fed back the view of 100 patients and 200 clinical contacts. Remote consultation and video consultation will remain with our clinic. It won't be everything, we will still offer face-to-face, but it does make a difference. Next slide, please. So now it's given us greater opportunities and options for us and our patients. It's allowed us to reduce the travel risk for patients coming from across the country, and the majority of our patients do like the medium. We will need to undertake longer term evaluation and evidence, but it has changed patient experience and access. And the one thing it definitely has taught us is that we need to move to EPR and have suitable clinical records available electronically as soon as possible. So I will stop there because I'm mindful that I am overrunning, but would encourage anybody to embrace video consultation. It makes a real difference for our patients. And although it doesn't save us time as a clinic, it keeps that important contact during a time when we have a national pandemic and people are feeling isolated and often very frightened. Thank you. So I shall now hand back to Sarah.
Thank you, Tina. That was absolutely fascinating, and I wish we'd got a bit more time to get into the more detail of that. But I think it just goes to show that experiences have been so different, haven't they, through COVID? And there's some really positive transformational changes happening as a result of COVID. So thank you. So on the screen now, you can see our September positive stars. Just take a moment to have a look at all of those names. It's great to see so many staff nominated. I'd like to say thank you to all of our presenters today. It is odd presenting and not being able to see any feedback. Thank you presenters. I'd just like to give you some real-time feedback. The staff health and wellbeing team have already got lots of emails about menopause, so there's clearly lots of people keen to get involved. The other thing I'd just like to remind you of is in 10 days time, that virtual Black History Month. Please get that in your diary. Thank you to the production team behind making this live event run smoothly, and also echoing John's thanks at the beginning. Thank you to all staff. It is a tough time at the moment, so thank you for your hard work. So I'm going to bring the October Connecting Knots event to an end, and just say the next meeting is on the 17th of November. Thank you very much, and bye-bye.